You wouldn't buy a car without a seatbelt, a laptop without Wi-Fi, or go a day without your cell phone. Could a business survive without the internet? Then why are many healthcare providers and provider organizations still not connected and enabled to share critical clinical information digitally in the care of your friends and family? Welcome to Kno2fy, a podcast from Kno2. Join host Dr. Peter Schoch, Chief Health Officer, and Therasa Bell, Founder, President, and CTO, as they bring the profound impact of healthcare communication to life through frank conversation in understandable language and through real-world context. They'll demystify interoperability, helping you unlock the potential of healthcare communication at scale. You'll also learn the transformative impact of being Kno2 Connected. Connect, listen, transform.
Welcome back, everybody, to another episode of Kno2fy. Happy to be with you today. Today we've got a great show. We're going to be talking about digital health platforms and the importance of being Kno2 connected and being interoperable. So really excited about that. I'll tell you what, though, before we start, it's also a big day in my life, I have to say, Therasa, a big day in my life. And the reason it's a big day in my life, you ask?
Yes. Why is it a big day in your life?
Yes. Okay. Thank you. Wow, that was hard.
And it didn't even come to my mind. Okay.
Apparently, I'm a dentist because that was like pulling teeth. But I think the big day in my life is Lionel Messi, who plays for Inter Miami, is coming to Orlando. And I get the privilege of going to watch Lionel Messi play. It's been a dream of mine for some time. So hopefully he's not on the injury report. The weather looks like it'll hold, and I'm excited to be able to see him. So that's what's going on today for me, and I've got a little extra excitement in my voice today.
I think you said to me, that's awesome, by the way, I know how important it is to you, but you told me that it was a bucket list item, and I think my response to that is that's great because you don't have much time.
Yeah, which is not the nicest thing a coworker's ever said to me, I have to be honest with you. It may not be far from the truth, who knows, but I would be shocked if you knew before me.
Yeah. Well, that is awesome. I know how exciting that is to you, and your elation is evident in everything you're doing right now. So I'm excited. So
yeah, my whole family's been subjected to soccer for years and years and years, and both kids have grown up with it. So it's a big deal and just fun for me. Not a big deal, but fun for me. So what's going on with you? You are where now? Traveling somewhere in Portland?
I am. I actually had it's coincides well with our topic today. I went to an event yesterday evening with some healthcare executives and had a chance to see a digital health platform named Reperio. I think we're actually going to be doing a podcast with them coming up. But they're the first digital health platform to ship. It actually does real-time blood draws and everything. It's not like what Elizabeth Holmes deal here that we're talking about. It is fantastic. I got see the whole thing in where they're coming to market in the fall, but they already have some. They're very targeted to the self-employed or self-insurers that are handling it. But they give these assessments and these wellness kits to ship to the home. But they're also providing a platform for providers to provide telehealth and virtual care. And got to see it in real time. Kno2's integrated on the back end. But it was real-time AI looking at the data, not only from the data that they're pulling from the networks through Kno2, but also the data from the results. So it was awesome, an incredible event, great discussions, lots of opinions on where kind of telehealth and virtual care is going, but great. It was a lot of fun. So in Portland, Oregon, that was a long-winded answer, sitting in my hotel room.
Well, I'm glad you could join us for heaven's sake. I know you got a flight coming up in not too long, but I'm glad you could be with us today. It's an exciting thing, too, about what you're talking about with the platform. And we could say their name, Reperio. They're a partner of ours, a new partner of ours, and I think they'll be a guest on a podcast upcoming where we'll talk much more specifically about their platform and what they're doing and how they're using Kno2 in the context of that treatment relationship for virtual care with the patient. So really exciting stuff. Now, I can't imagine that that's what you look forward to. Did that jazz you as much as my getting to go see Messi play tonight?
It did. It did. It was fantastic. It is not very often that I get to get all the way to the edge and see how there's so many partners coming through, how the technology is deployed, but then also to see how people are engaging with it. They did the assessments right there. They gave everybody a kit, walked it through it. So it was real time,
that's really cool.
real life. It was super fun. And then they had a provider come in remotely through their platform and use the platform real time. So it was very edifying for me, that even though we're a fraction of what they're doing, it was very edifying to see it, that we're doing the right thing and how much care delivery is going to change in the future. It's constant education for me. And the people were really great too. That's some really fun people. So.
Yeah. And I think what you just said about the edge and being able to see technology used at the edge for the purpose for which it was intended and the problem that it was intended to solve. That's really cool. And that's one of the coolest things about some of the podcasts we've done with partners is being able to talk with them about their experience and how they're using interoperability. So totally agree. And I think that sets the stage for a great discussion today, not just about virtual care, telehealth, and this partner, which we'll dive into more when we meet with them in a podcast, but more just about health platforms in general. To set the stage, just because physicians and health systems and healthcare entities use electronic systems of record to record patients, there is a whole genre of healthcare IT out there that is related to how do we make the experience for physicians better? How do we make the information we're giving to providers better at the point of care for specific purposes in care? And they can be things from population health and analytics tools to care coordination platforms, to remote patient monitoring platforms, to virtual care. And all of them have their greatest value when they're connected to the remainder of the healthcare ecosystem and are Kno2 Connected. It really gives them the freedom to unlock the potential of their solution across the healthcare ecosystem in a broad variety of use case settings as we move forward. So looking forward to talking about that as we go forward here. We'll take a quick break, come right back for break, and then get right into the discussion.
Hey everyone, my name is Matt Becker, VP of Interoperability at Kno2. I wanted to take a moment to introduce our connectivity report. Did you ever wonder who in your area you could connect with digitally and reduce the manual activities associated with clinical information exchange? Well, simply visit Kno2.com, click the link for connectivity report, then enter your name, email, and zip code, and we'll send you a report to show those providers and provider organizations already connected and waiting for you to join them. Take the first step to getting Kno2 connected. It's free, takes less than 30 seconds, and will spark digital transformation that could revolutionize your business. There's even a how-to video to make sure you get the most from the report.
Connect, listen, transform. This is Kno2fy with your hosts, Dr. Peter Schoch and Therasa Bell.
Well, welcome back for break, everybody. Really excited to dig into the conversation with you, Therasa. And I think maybe the first place to start is define kind of a usable definition of what a digital health platform is. I think if we're talking about that, it's really around what is a digital health platform? What's the breadth of digital health platforms? What's their function and overall healthcare? How do they fit into what we do? But let's start with a usable definition.
Yeah, I think it's a usable definition. I like the way you said that. If you think of really, it's kind of any technology that is delivering or engaging with the patient and the providers that sits outside of the electronic health record. And we're seeing all sorts of new care models, right, that are coming forward. And it's a broad term, right? And a lot of people use it for defining different types of way care delivery is happening. So I'd say it's any kind of care delivery platform or solution that sits outside the electronic health record.
But I think one of the other things you said there that's incredibly important to me, but brings useful information to providers that drive the purpose of use of treatment for that patient, right?
Providers and patients. Yep, definitely. Yep. I mean, if you look at the buckets that's underneath, you have, just broadly speaking, you'll have your remote patient monitoring solutions. You'll have patient engagement solutions. I think I'd put virtual care delivery platforms in there. Telehealth would probably be in there from a technology perspective. And I think you had mentioned things like population health, right? So you've got broad categories underneath a broader category of different solutions. And They each have kind of their own nuance, but how they connect, what data they create, what data they consume, what workflows they cover is variable, but covering discrete problems in healthcare. And that's what that healthcare ecosystem is becoming. It's all of these digital health. In some ways, it's pretty fun, but it also is going to create some challenges as we look to the future, where we used to have kind of a unified system of record and a unified way of doing things in the EHR. Now we've got all these different ways that providers can solve for discrete problems in really nice ways, but then how do we bring them together, right? How do we unify that, and what does that look like?
Yeah, that's interesting. It's interesting. That's a really interesting point I want to get into a little bit further. I also think it's interesting you said we used to have a single way of doing things, or a unified way of doing things, because we were all on different EHRs. I mean, the most unified we ever were was when we were on paper and people were writing in cursive. But even then, some people were writing cursive, some people were printing, right? But there were standard medical abbreviations, and everybody wrote in the English language in a medical chart. And that was the most unified we ever were. But it was also the most disconnected we ever were, right?
A fair call out, because I was representing unified within the four walls of like a provider's office, that was the way they did work. But you're right, from a unified kind of provider community, we're all on different EHRs, and obviously that's been a source of work and effort to unify the sharing of data between the EHRs. But I was kind of referring to it within the four walls of a provider, how they would unify.
Stay with that, because I really like that, because I wasn't thinking that way, and I think there are kind of two levels there, right? There are, how do I, as a physician or a healthcare entity, manage the totality of the care of a patient and everything that goes with it in an integrated way in my office, because my EHR isn't going to do everything. My practice management software isn't going to do everything. And let's be honest, even EHRs that do a lot don't do every one of those things well, right? They may have a module that's their clinical module is better than the practice management module that is better than their billing module, or vice versa. Or they might have 2 out of 5 or 5 out of 6 modules that are really good. Even the largest EHRs that service health systems in the country and have multiple modules across acute care, ambulatory, specialty, and post-acute don't have the leading software necessarily solution from an EHR perspective in every one of those particular areas. So as a physician, I'm looking for, how do I, and this is always something that we talked about, is do I go for best in class and I knit together a bunch of different things, or do I go for a unified, integrated mechanism of doing things and realize that it's not always going to be best in class, and there may be some things I can't do because that integrated solution doesn't have it. Digital health platforms are making us rethink that strategy a little bit, because they're so good at solving very particular problems that we face in healthcare. And then outside the physician office, integrating across different EHRs and so forth as well. Because if I'm a digital health platform...
I'm sorry.
No. I was waxing philosophic. If I was a digital health platform, I'm looking to connect to as many people as I can and solve the problem for as many people as I can, and they're all going to have different EHRs and other systems in their offices. There's a logarithmic complexity in the connectivity that needs to occur to actually integrate the different solutions that we need to have. I think that's one of the challenges, and the good thing is being Kno2 Connected helps solve a lot of that challenge, and I know we'll get to that in these platforms. I didn't mean to cut you off, though. You were going to say something additionally to that.
Well, I think it'd be good to answer why are digital health platforms popping up everywhere? What's driving that? And you look at your point on the EHR served its purpose. It definitely has weaknesses, but it was designed. The vast majority of the EHRs were designed for that in-person episodic care delivery. Presenting, right? The patient presenting, there's a provider there, and it's meant for that, even though sometimes there's a lot of improvements to make even in that. But you look at all the market forces that are forcing us into forcing providers into figuring out new ways to deliver care, address things like provider shortages, address things that, as we see certain chronic conditions, and I'm regurgitating things I hear from you. There's many market forces that we're watching, and that's what's causing this boom of digital health platforms that we need to make sure get connected, because while we think we're getting to a really powerful state in this country with all these digital health options and all these different ways to do it, it actually is exacerbating what's been a problem with, just like we started the conversations with electronic health record vendors talking to each other. Now we're magnifying that exponentially with every platform that comes on. If they don't get connected and share the data they create and get access to data, the problem is going to be 10 times worse than it has been just with electronic health records. So it's interesting to get the why and what's happening.
Yeah, I also think when you talk about the why, I think electronic health records solved one big problem in healthcare, and I really want to give them credit for solving that problem. It digitized clinical information, right? It digitized clinical information and made it available for analysis. It made it available for reporting, and it made it available for exchange at scale, okay? But it didn't solve the problem of exchange at scale. And it didn't necessarily solve all of the problems, as you mentioned, related to optimal care and optimal process in caring for a patient. It didn't solve the process for asynchronous care delivered to a patient initially out of the gate. We saw solutions come with patient portals and integrated video visits and telehealth and some of the platforms here over the last decade and a half, but it didn't come with that to solve that problem. And many of them actually didn't solve for the clinical document in the way that providers needed it to solve for clinical documentation. It provided a documentation methodology, but it did so for the purposes of claims submission and billing validation and verification, right? Or payment validation and verification. And the clinical pieces seemed to be a bit of an afterthought in that regard. I think they've come a long way since that time, as many EHRs have had physicians in their C-suites and in their dev teams kind of thinking through how those things happen. But I think what it left was physicians having a way to digitize healthcare information, but not the easiest way to use it. And the information not necessarily presented in the easiest way to a physician to be digested and then move to a treatment decision or move to a management decision, those kind of things. So I think I'm expounding on the why of the rise of digital health platforms in that regard. The other thing that I think it would be remiss if I didn't say this, and I'll put my clinician hat on for just a second. So I ought to warn folks that there's doc talk ahead here, so to speak. But it stands true that about 85% of what I need as a physician to make an accurate differential diagnosis comes from a thorough history of the present illness, a thorough review of systems, a thorough past medical, past surgical, past social history, and 15% comes from a pointed physical examination based upon what I gleaned from the conversation and additional lab testing or diagnostic testing. So when you think about that, 85% of what I need to know to get a pretty good perspective of what's going on with you and next steps comes from a conversation. And conversations can happen in a number of different ways, right? We used to have them all in person, but they can happen virtually and virtually synchronously through video or phone, or they can happen asynchronously, right? Through text and other things. So when you think about that, and I want to shift now to talking about the impact of these health platforms. When you think about virtual care, there is a real evidence-based reality that virtual care is both possible and incredibly effective, or as effective as in-person care in a lot of cases, if we use it correctly and if we support it correctly and if we do the things necessary to actually connect it to the rest of the healthcare system so that a provider has that option available to them in addition to everything else they have going. And that option isn't disconnected from what they're doing on a daily basis. Anyway, I get ahead of myself, but I think I just want to set that stage that how information is received by providers, it's not all about physical examination and diagnostic testing. If we actually do the work of listening to what folks are telling us and asking the right questions, we can get a ton of information. And then you think about, what if I didn't have to ask those questions because somebody else did? And I could just get access to that information. Anyway, I wax on. I know that you look like you want to respond.
I just don't know where to talk. You went down a spot that I really wanted to engage on, but I don't like to interrupt you. But
well, interrupt me. Yes, it's free flowing. You know me by now.
The discussion that or what I engaged with last night was exactly what you were describing. Reperio, and again, we're going to have them in a future podcast, so I'll spend just this time on it and then we can move on. But it was a virtual care platform to address the provider shortage, and it puts nurse practitioners in a virtual care setting. So it's kind of like the Uber, where they'll find nurse practitioners that can, hey, I've got a few minutes here. I'll go, log into the portal. I'll grab the next patient in queue that wants a virtual visit. But they showed real time what was happening to be the most effective virtual visit they could have. Was they were collecting historical information on the patient. They looked at an AI, they were showing AI learning about the patient. They were showing it real time behind the scenes. And then all of a sudden they had these I don't know if it's diagnosis. I don't know if they had different suggestions for the nurse practitioner that was sitting there, and they would work their way through. So they would go through, they had a virtual care setting, just like we have right here. They were having a discussion, and it was prompting them with different details, and they would go through it and confirm or deny what was being presented to them by AI. So asking them a series of questions to the patient, but it was so effective to watch it. And as they would select something that, because AI is certainly not perfect, right? It presented it and they would say, no, that's not it. And it goes right back to the model to learn why that suggestion was not right to be better in the future, right? But you can imagine that over time, the effectiveness of dealing with data real time, allowing that nurse practitioner to engage with the patient and, quickly get to the outcome or the assessment. It was amazing. It was an amazing experience, and it was really smooth. And I'm like, I was reflecting on my in-person provider experiences, and it was far more efficient than that. And there was still that warm feeling of seeing the patient and talking to them. So you didn't really lose that. But it was incredible. It was incredible to watch the technology. And you think about provider shortage, just address that, and the ability to take care of some baseline needs that we have as a population, especially in rural areas or areas where patients don't have access to care. So sorry, now I went on, but
no, that's a really interesting thing, and I want to make a distinction too for the audience. I'll put my provider hat on again. In the case you're describing, it's an AI model that is assisting a practitioner in the differential diagnosis and in analyzing the multitudinous data they're getting from other sources as well as from the patient to arrive at a clinical decision that's more accurate and beneficial. It's not the AI being the provider. That's a distinction. That's an important distinction from the purposes of use of treatment. It is AI is an assistive device to the provider in real time, not the provider itself, which is a really important distinction there. It's interesting because I don't know if you've ever seen the movie or how many of our listeners have seen the movie Devil Wears Prada. I watched it years and years ago, and I once had a chief of staff at an old health system that I used to work for, and she used to laugh, and I had forgotten about the movie completely, but she said, I want to give you Prada level support. And I said, I have no idea what that means. And she said, have you never seen the movie? So I went back and I Googled it and watched a scene. And it's where the executive assistant of this, designer person is walking behind her into a party. And she starts saying, this is John so-and-so. He is the CEO of X. He has 2 children. One went to Harvard last year. The other one, whatever it was. And they prepared a report. So it's kind of AI is that Prada level support for a clinician. It's kind of
I don't think that there's an AI model that could support your needs. That is absolutely that is a perfect example of exactly what you just saw on screen, because the patient didn't see what they were looking at. It was just being prompted to them. So they felt, man, this provider really knows me. And it's the first time I've ever encountered them on the screen. Right? They really know me. And that's what I was relating to, is like, if I've gone to a new provider for some reason, and then I relate to my dad's experience when I went to his neurologist, it was night and day difference. It was incredible. So it just gives me hope that we can start to, as we always talk about, solving some of the foundational problems in healthcare. These are the types of technologies that we're enabling that will do that.
Yeah, it's funny when you say about being seen, because I think, and from a patient experience perspective, because that's so important. It's important when you're not feeling well from a cold or flu that somebody has empathy for you and understands that. It's even more important when you're actually unloading about depression or the loss of a significant loved one or a chronic illness that's impacting the rest of your life and how you function the rest of your life, and that you're on medications or affecting your financial status. it's incredibly important that you feel seen and known in those moments, even more so than those acute care, self-limited issues. So I really appreciate you pointing that out. So let's talk a little bit now specifically about the value of being Kno2 Connected as a digital health platform. I imagine there are many, many listeners out there that are either using a digital health platform, trying to evaluate digital health platforms to solve a problem in their business, or are a digital health platform themselves. And I think it's important to understand the value of being connected to the healthcare ecosystem, and the sharing of clinical information extends not just to clinical systems of record like EHRs, but to these digital health platforms, enabling them to be much more effective for both patients and providers that use them. So I don't know if you want to take a class, Therasa, and talk about it a little bit. I mean, maybe we continue on the conversation real quick with virtual care, because I think that was the one that's most recent on your mind. And then we'll move into the others a little bit. But I'd love to hear your thoughts around that.
Well, I think that's exactly where I was going to go, is virtual care first, because we've got what I'm seeing from a non-provider view is these virtual care platforms that are very, I call it discrete. They're narrow, and I don't mean that negatively. They're narrow in the problem that they're addressing, or the group of patients that they're addressing. So we're going to have a lot of virtual care platforms, right? So we look at some examples that have come through Kno2. We have a group, I think it's called Ripple Care. They're out of Seattle. They manage early stage dementia patients, referrals for early stage dementia. So if they had a patient that was seen in the hospital, or they were diagnosed by their provider with early stage onset dementia, that gets referred into the Ripple platform, and then they start to work with that patient and the family to manage for that particular disease and help them with their settings and what to do to, I'm sure that there's what to do to prevent further progression of the disease. I know you're dying right now, but it's amazing, but it was very discreet to that, right? And how they engage, what providers they engage in the community, who they engage, how they engage them. And they're doing that through Kno2, right? And then a second group was that we've also had on our podcast is Equip Health. And I keep coming back to that one because it just resonates with me so much. But the data, Equip Health is take like a pediatric patient that has a eating disorder. That data that goes from the pediatrician to now a virtual care eating disorder platform that refers it in, the data that they need and what they're doing with it. But they're very narrow to eating disorders. But that narrowness is what makes it so effective in delivering care. So there's lots to talk about around there, but I'll start with kind of those two examples of partners that we have. And we have many of these that are providing virtual care services.
Well, we're talking to one now whose name I won't mention. That's I think really came to us because they have a niche in employer health, right? And workers' comp, right? And kind of using a digital AI assistant, but also to manage who are injured at work or have musculoskeletal injuries that impact their work, et cetera. And I'm sure I'm not doing it justice, but I think it's a really important model. But again, it's solving a particular niche use case, which is an incredibly important use case. But what's universal about all those three examples is every one of them needs access to the clinical information contained in the system of record, and needs to be able to bidirectionally share information with that system of record so that the care for that condition is not done in isolation of the whole person. And when I say whole person, I mean whole person from a standpoint of mind, body, spirit, their whole health, but also their longitudinal health. And I'm not talking about a longitudinal record. I'm just talking about data available across time to be delivered at the point of care bidirectionally.
And I think that point on data it's a really important topic. And I would say that as a company and for myself, we're also just on the cusp of understanding exactly what parts of the US CDI, which is the data set for those that are not technical on the call, the US CDI is identified by the federal government as kind of your comprehensive data set of clinical information, and it keeps expanding. But what matters in particular care settings and in these virtual care settings is not the complete set. It's components of it. You've always said that. Give me the right data at the right time. And in these, unlike an electronic health record vendor, where they want to consume a large part of data to manage bringing that patient in, these digital health platforms have a very discrete need, and they're a perfect use case, one for fire, and CDA, but for fire because it becomes very discrete in what they need. So take like that example of Equip Health. And it stood out to me in the conversation with them. If they have a pediatric patient that is referred in, the most important thing that they want to look at is the growth chart from the pediatrician. And how that growth chart presents itself in terms of data when it gets pushed to them is really important. And I've spent time now researching what do the growth charts look like in fire? What do the growth charts look like in CDA? And what does that consumption look like? And then conversely, spending time with them is once they assess the patient and they put into, a care plan in place with the patient and their family, what data should they be producing back? Because it's not really a traditional care set, right? What data should they be producing back to the broader community? So if that patient, for instance, goes to the ER because of their eating disorder or for another reason, Epic queries and they happen to, get the data back from Equip Health, what presents to that provider, that ER doc, that says, oh man, that patient showed up with whatever, the reason would be, what data would be the most meaningful from Equip Health back to that ED doc or to their PCP, right? So their PCP or other providers that are in their care journey. Those are the things that I constantly spending time in. I think we're just on the cusp of getting really intelligent infrastructure on the Kno2 side that helps with that data use and delivering the right data at the right time. And I'm sorry, I went on for a long time. This is where my technical hat just...
No, this is perfect because I think that's... Yeah, no. I think we spend a lot of time talking about it internally at the company. And I think it's incredibly important because I think that speaks to the maturation in the conversation from just connectivity to intelligent connectivity and broadens meaningful communication from just the edge, meaning EHRs at the edge, but to include the digital health platform space as being able to, how is that data presented? And I think this meaningful communication, intelligent connectivity, if I look at intelligent connectivity, it's getting connected first. That is absolutely the base. And there is so much work yet to be done to get the edge connected, right? And using it. But one of the things that will help the edge use it is if the connectivity isn't just broadly to a dump of data, either filed in their EHR because we don't know how to deal with it on that end, or put into something that the physician or provider has to sift through to get to what they need. So if we can be intelligent with the data we deliver across the network, such that it makes it easier to ingest, and the EHRs can be very purposeful about how they display the information, what information they display, even if they want to take in all the information, which do they rise to the top and display, and which is available to go and do a deeper dive on, right? Because that's really what, and then how do physicians aware of it so that they don't have to fear that there's data that they're responsible for that they don't know is in the record in that regard. So I think, and I know we digress a little bit, but I think those are important concepts, and we've talked about it from an adoption perspective, but I think it's incredibly important to understand this construct of intelligent connectivity and meaningful is kind of the maturation of where we're headed in interoperability.
Yeah, absolutely. And it's just, this one's super exciting to me because it's like you always say to the company is we are solving the foundational problems in healthcare that our healthcare system is facing into. And
so I'm going to stay on. Go ahead. Keep going. Sorry.
It's just attacking the foundational problems because it's not technology for technology's sake. I love technology for technology's sake, but it's what are we doing, like you said, the outcome of it to really face into these headwinds that we are absolutely feeling right now in healthcare. And it excites me. It is really meaningful to me that we can have this kind of impact in healthcare.
Yeah, when you were saying technology for technology's sake, I can't tell you how many times I've been an early adopter of a device or some technology, and it's had one use case and never been able to expand beyond that use case, and so I've quickly fallen off and not used it. Interoperability is not that. Interoperability, as we're serving it up, actually has the ability to meet and mature into whatever use case we need to manage to, if we're diligent about what we do around intelligent connectivity and at the edge from a meaningful communication perspective with EHRs and digital health platforms. If we're diligent about that and understand what the impact that has on the usability, when you buy interoperability, you're buying an infinite solution because it just allows you to connect and communicate and share information. And I think its utility will be enhanced by what we're doing around intelligent connectivity and obviously greatly enhanced by meaningful communication at the edge. I want to get back on the virtual care thing for just a second and close out that segment of digital health platforms very quickly. I think one of the things that always struck me is virtual visits were heralded as the second coming of healthcare for the last 20 years. And yet they have not been drastically adopted or significantly adopted over that 2-decade period of time, with the exception of about a 2-year period of time during the COVID pandemic. And there's always a lot of questions about why. There was an expectation that, hey, we've just broken through the adoption barrier and now we'll have a persistent adoption and use of virtual care beyond the pandemic, and that has not borne out to be the case. We have seen a persistent slight increase over pre-pandemic rates in a lot of cases, but we've not seen the dramatic 50 and 60% utilization of virtual care visits like we did during the pandemic. And to me, that's not surprising for a couple of reasons. During the pandemic, there were 3 big changes that occurred. Number one is the regulatory requirements around the technology were relaxed such that more technology was available, and technology that was familiar to providers was available to use as approved technology for virtual visits. Meaning all of a sudden I could FaceTime with a patient and be able to get that information. Secondly, the reimbursement models were significantly different during the pandemic as payers recognized that the only way that they were going to have patients receive routine chronic care in addition to non-urgent, non-emergent acute care outside of COVID was to be able to provide it virtually because people were scared, health systems were closed down, they didn't have access to in-person care in a lot of cases. And so what they did was say, we're going to reimburse it in the same way that we would reimburse an in-person visit for that process. And there was a wide change in how physicians and healthcare practitioners were reimbursed for virtual visits during that period of time. And the last one is there was also the third one, there were actually 4. The third one is that there was a relaxation of the regulatory process and requirements around who could provide virtual care in what jurisdictions, such that it was easier for providers to be able to provide virtual care to patients, whether a patient was in their state or outside of their state, et cetera. And then the last thing was the urgency of the pandemic. There was no alternative for care in some of these communities for a period of time. So all of those things, all the regulatory and reimbursement things were either an emergency order or following an emergency order, or they had no alternative to care. And those things all went away after the pandemic. So it's not surprising that we saw a reduction in virtual care. The reason in my mind, it's probably more than one reason, but there are a couple of reasons in my mind why it still hasn't taken off the way we would anticipate it takes off. Because if truly 85% of what I need to make a good differential diagnosis and begin treatment or management of a patient is contained in a conversation, I can have a conversation in a lot of ways. It doesn't require it to be in person, right? And we've got very sophisticated in the ways we can do that: video, asynchronous, text message, et cetera. But one of the reasons I think it hasn't taken off is because we still see it as a subset of care outside of the healthcare ecosystem. So if you think about post-acute, that we're very, very familiar with and advocate for and have been in service of for some time, virtual care is kind of that segment of healthcare that post-acute has been over the last 50 years, meaning it's kind of out there. Mm-hmm. It's not really part of healthcare. So one of the big things that we can do is a digital health platform that is providing virtual care in any of its iterations or across all its iterations, getting connected and being able to bidirectionally share information and query for information on patients to be able to connect them in a very real way to the healthcare ecosystem is incredibly important. They no longer become a distant uncle, they become immediate family in the care of that patient. And the care that is rendered in virtual care becomes incredibly relevant because now it's available for me where it wasn't available before. And if it's not available, it's not relevant to me. And my care becomes relevant to them because it's available to them and actually makes the process easier for providers. So I think that's an incredible thing that if we can open in the next decade, we should see improved adoption of telehealth platforms. And that's what excited me so much about your experience that you had with one of our partners, our new partners last night. So,
yeah. I totally agree. The experience has to be better for something like that to stick. The experience has to be better than what I'm used to, or to stay and have any kind of permanence. So getting into mainstream healthcare, becoming integrated into the healthcare delivery models is the only way it's going to stick. And there's a long tail to that. That's just change over time, right? That type of thing won't happen overnight. For many reasons, it can't happen overnight. So it has to be, to your point, integrated into the care delivery models closer to mainstream healthcare. And that's where we'll see the stickiness in it. And then, of course, you would know more than I do, but the reimbursement models around it have to support that.
Yeah.
Elicit that kind of
I think that's right. I think that's right. I think it's interesting because I think that there are all manner of reasons that the reimbursement rates have traditionally been reduced for telehealth visits or video visits. You have to understand the provider's mindset at that point is, I'm using the same expertise. I read something the other day. I don't know, it was one of the social media things, but it resonated with me. It was a guy was asked to come onto a cruise ship and fix something that went wrong with the engine and had the cruise ship stalled out in the middle of the ocean with, thousands of people on it, not going anywhere. He came out and in 20 minutes, he took out his hammer and he hit this one valve on the engine, somewhere around the engine, and the engine kicked right on and was fixed. And he charged him $20,000. And I think it's a story. It's not, but it's a story that illustrates the principle. I don't think it's an actual story. And he charged him $20,000 for it. And on the itemized bill, it was, one hammer, 20 minutes, $100. Knowing where to place the hammer, $19,900. Because you wasn't paying him for his time, you were paying him for the expertise in that regard, right? So I think there's something similar in this process, or a similar perspective in this process. The physician is using the same expertise they do in person. Why is it worth less? Because it's coming through a virtual visit or a asynchronous text message, that kind of thing. And so, again, getting in the provider's mindset and understanding that, and then understanding that decreasing the reimbursement per episode is probably not the way that payers are going to actually save money through virtual care. They'll save money by making it more available and access easier to patients, to their primary care doctors or to their ambulatory provider who's taking care of a chronic disease, so they don't go to the urgent care and don't go to the emergency room where the reimbursement is significantly, where the expense is significantly elevated. So I think it's just also a shift in mindset and just understanding those pieces as well. So I'm going to change tack for a second. I'll give you a minute to respond to that. It looked like you might have had something to say. We'll
great. I think that was a great conversation.
Okay. And I think, I know we're coming up on time here to take a quick break, but I don't want to forget there are other segments of virtual care. Remote patient monitoring is one of those. I think the same truth about connectivity is important. The same truth about being able to get the right data, being intelligently connected so that the right data is moving through. In other words, somebody sitting at home on a remote patient monitoring platform who's getting blood pressures done, 10 times a day, 5 times a day, whatever it is. I don't know as I need to sift through 70 blood pressures to find the one I'm looking for. So how do we get the right data to them? How do they get the right information to a provider, those kind of things? And how do they get the right information from us to make setting somebody up as seamless as possible or enrolling somebody as seamless as possible? I think of care coordination, and we want to touch on that. I think of population health, which we haven't even gotten to. Why don't we take a quick break? We'll come back and we'll wrap up maybe mentioning those couple of things and then thoughts or takeaways from today.
Great. Sounds good.
Hey, Maddie, what's going on? How can I help you today?
I think my allergies are acting up. I've had a runny nose for a few days now and my eyes are itching, but I don't have a fever or any other symptoms.
Okay, well, honestly, after examining your symptoms and examining you, I think you're in great health. And I think your allergies may just be acting up, but honestly, some allergy medication should really just do the trick.
Yeah, that would be great. Thank you.
Of course. Let me take a quick look at your chart just to confirm your meds and your allergies, and then I can get that sent to your pharmacy for you electronically. That way you can pick it up on your way home.
Okay, thank you.
No problem. Maddie, I see from your chart here that you went to urgent care 3 months ago for a similar complaint, and they thought you may have had a sinus infection and gave you an antibiotic and a decongestant?
Oh, yeah, that's right. I totally forgot to tell you about that. I was at the beach with my family. Wait, how are you able to see that?
I can see that because our EHR is actually Kno2 connected. So what that means is that we can share clinical information with other providers electronically and automatically. So essentially, no matter where you go, I'll have line of sight into your care, and I can also send your records electronically to others if they need them while they're caring for you.
Oh, wow, that's amazing. I've never heard of anything like that before, but it's great to know that you're looking out for me no matter where I go.
Of course, we have the ability to connect with anyone, so it helps us make better clinical decisions and truly just keep our patients safe. So, in your case, the records I received indicated an allergic reaction to the antibiotic. Do you remember that?
Yeah, I do now. I broke out into a rash and had to go back for additional evaluation and treatment. But it was really painful. I was itchy all over, and I wasn't able to get any of my work done throughout the day.
Yeah, I can imagine. Let me do this for you. I'm going to include that allergy in my chart here. That way, your record is up to date and complete, and it will avoid anyone giving you that same medication going forward.
That would be great. Sorry, I totally forgot to mention that.
No, it's okay. Don't apologize. It happens all the time. We're all busy and we just honestly forget stuff.
Yeah, you're right. Thank you.
No problem. And trust me when I say we have your back because we're Kno2 connected. You're safer. We can see all of your care even when you can't remember it.
Connect, listen, transform. This is Kno2fy with your hosts, Dr. Peter Schoch and Therasa Bell.
Welcome back, everybody. Had a really robust discussion. I think, well, we only kind of talked about one category of digital health platform, really in virtual care. I think all of them have some component. The only one that probably stands out a little bit differently to me might be value-based care, related to some of the analytics and the impact of information from the payer as well as information from the clinical record when there's a payment and operations function perhaps, and also a significant treatment purpose of use in that regard as well. We'll talk about those in a series coming up around value-based care and the interoperability's importance to value-based care, so we'll pick it up there. We can also touch on the care management platforms and some remote patient monitoring platforms that help in value-based care settings. So we'll pick those up when we talk about that in that series. So, Therasa, I'm going to pitch it to you for just quick closing. Any quick parting thoughts related to today's conversation for either those that are looking at digital health platforms for a particular use case, digital health platforms that are out there, what might be relevant or you want them to take away today?
Yeah, as you were on your previous statements, I was thinking on from just a classification of digital health platforms. I think there's a distinction between platforms that for instance, are providing like virtual care services where they're kind of their own entity in itself, right? And then there's digital health or HIT platforms that are a complementary, or you would say adjacent technology to the core EHR. The interoperability needs are very different. So take like remote patient monitoring as a perfect example. The primary care doc or the doc is working in their EHR, their native EHR, and they create a referral for remote patient monitoring, or they create an order for remote patient monitoring, and it goes to the RPM platform, and there may be a group of providers, there's a lot of data being collected, but that data needs to make its way back into the record of the EHR. Versus like if you have like what we talked about, this Equip Health group, or you talked about these different groups that are running standalone, they're creating it and they're kind of beginning to end right within their platform. Two very distinct needs for technology and how we incorporate it back into the ecosystem and what that looks like, especially as we think about the national networks and what it's going to look like in QHIN. And those will be fun conversations coming up.
Yeah, I agree with that. I'm really looking forward to this conversation, especially the last one in terms of, for me, the value-based care piece is big, and then also the importance of TAFCA from a connectivity standpoint and how digital platforms need to understand that is the future of connectivity. Very important for them to get involved and make sure that they have QHIN connection in that regard. And happy to talk to them about that. I think the most important thing to me from today's conversation is really around understanding why digital health platforms are on the rise, the value of digital health platforms in terms of what they're trying to solve and how they fit into the overall healthcare technology ecosystem. And then 3, in the big categories that we're serving across our partners, the importance of being connected, being Kno2 connected, so that you can actually share information bidirectionally and become a legitimate member of the healthcare family. Legitimate. I use that in quotes because I think that's legitimate, but I don't. I think I'm going to rephrase that because I don't think it's a legitimacy. I think it actually brings you into the nuclear family as opposed to a distant relative in healthcare, similar to what the post-acute has experienced over the last 20 years, and the recognition of the importance that they play in the overall healthcare delivery system. Well, thanks everybody for being with us today. We'll go ahead and leave it there. We'll see you next time on Kno2fy. Thanks, Therasa.
Thank you.
Thanks for joining us today. That's a wrap for this episode. Please subscribe or follow on your favorite podcast platform to make sure you don't miss an episode. Get Kno2 Connected today and set yourself and your organization free to unlock your potential. For more information on the value of being Kno2 Connected, visit us at www.kno2.com. Follow us on LinkedIn or Twitter. Connect, listen, transform.